the people that are the most likely to get sick right now are our children.
With Canada now fully in the grips of a fourth wave that's infecting younger, the country's health minister is urging us adults to get vaccinated to protect those who cannot.
You know, it's scary to think that the highest case growth rate is in the 0 to 19 age categories.
Several provinces have reported a steady rise in COVID-19 cases in children 5 to 11 who are not yet eligible for vaccination. Health Canada says it expects data from Pfizer on pediatric shots as soon as next week.
Then they'll file a submission with the US FDA, and then shortly thereafter they'll file a submission with us at Health Canada, and we're expecting that to come in likely before the middle of October. But they have noted that they'll give us some clinical trial data in advance so we can start working on that.
In a study involving thousands of kindergarten and elementary school-age kids, Pfizer tested much lower doses. It says produced a robust antibody response.
There are some differences in the formulation as well. So it's not just the clinical trials and how effective and safe the vaccine is, but we'll also be looking at this other formulation.
In another piece of hopeful news, Health Canada says it's also currently reviewing a submission received in August from the makers of what could be the first pill used to treat COVID-19. Merck says its antiviral medication reduces the risk of being hospitalized or dying from COVID by approximately 50% for those who are considered higher risk.
We're actually working with some of our international counterparts going through the review of that.
The results coming from a study of nearly 800 patients who took the pill every 12 hours for 5 days. American health authorities today praised the pill as a potential breakthrough, but did not provide a timeline for when it could be approved by U.S. regulators.
The news of the efficacy of this particular antiviral is obviously very good news. The company, when they briefed us last night, had mentioned that they will be submitting their data to the FDA imminently. The data are impressive.
Merck says it plans to seek U.S. emergency use authorization as soon as possible. Caryn Ceolin, City News.